The AMA's efforts to absorb the profession soon turned to the eradication of the entire profession with the formation of the Committee of Quackery, or Cockerham. Throughout the 60s and 70s, they conducted several campaigns against chiropractic as a licensed health discipline through legislation and propaganda. One of the leaders of the committee at that time was Dr. Joseph Sabatier Jr. Although the AMA had been excluding irregular medical practitioners since 1847, it had created a culture of eliminating and absorbing alternate medicine. Medical students going into their careers regarded any attempts to have interprofessional relationships with chiropractors as unethical and would put their licensure in jeopardy. However, the AMA was losing money in the 1970s, and, worried about malpractice lawsuits, controlling costs, and losing members, the COQ had to be disbanded. But whatever policies or legislative actions they had enacted continued to be in effect. It seemed like any evidence of malpractice would remain private. But they were wrong! Around the same time, an anonymous source published In the Public Interest, a book which included reproductions of stolen documents from AMA headquarters and had commentary embedded throughout, using intentionally spiteful language that compared the AMA as a Nazi intelligence agency with satanic deceptive disciples. It was obviously trying to stir up controversy and reactions from the chiropractic community, specifically as these illegally distributed documents were sent to several news outlets with chiropractic-related materials included. This resulted in a federal investigation into AMA activities, and the distributor was now given the moniker Sore Throat, but that's another story. The point is, FBI found evidence to suggest that the AMA violated antitrust laws from its activity in the COQ, and as Dr. Johnson and Dr. Green note, the changing consumer attitudes towards medicine and healthcare made this an opportune time for chiropractors to take action. This all culminated in Wilk versus AMA, where 4 chiropractors filed an antitrust suit against several medical organizations, including the AMA, with conspiring to boycott the chiropractic profession. Before this lawsuit, the Sherman Act of 1890, the first U.S. antitrust act, was thought to only apply to business and industry. But this was one of the first cases where the learned businesses of medicine were starting to be considered to also need laws against the restraint of trade and abuse of monopolistic power. Also, a few months before the trial, the AMA revised its principles to allow physicians to work with any healthcare provider, although they never really clarified this change to the American public or health organizations. Thus, this court case was not about changing the code of ethics or undoing the years of harm, but to publicly prove that the AMA broke the law and should be reprimanded. During the first trial, the AMA legal defense argued the patient care defense, saying they had concern for the lack of scientific basis in chiropractic and needed to control the risk of danger to the public by eliminating the profession because they had no other choice. Although the chiropractor plaintiffs lost the first case, they filed an appeal saying that the defendants' focus was not based on defending the business and economics of the broken antitrust laws, but on the lack of legitimate objective evidence in the chiropractic profession. They were granted a new trial, with this time being a bench trial instead of a jury. For the second case, the plaintiffs argued that the AMA knew of the potential benefits chiropractic had for certain musculoskeletal conditions, but suppressed it so they could focus on eliminating the profession. They represented evidence by Dr. Freitag, showing that patients spent less time in the hospital with chiropractic care versus without. Whether this evidence is based on the placebo effect is still up for debate, but this statistic is still relevant as there is some kind of positive improvement for patients. Thus, on September 25th, 1987, the judge ruled that the AMA and its members participated in a conspiracy against chiropractors in violation of the nation's antitrust laws. Because of this decision, healthcare providers, not just chiropractors, are allowed to have privately owned businesses and work with medical physicians for the betterment of patient care. Although there is still contention for medicine about its legitimacy, chiropractic's impact on healthcare is undeniable. To get back to the original question, what is chiropractic as a whole? Well, It is way more than I imagined. There is so much written about this, and I could have gone so much deeper into some of these topics, but I wanted to keep this concise. After reading up on all this, I can safely say that I have a much greater appreciation for the work that goes into chiropractic and all the trials and tribulations it took to get to where it stands today. Despite the biased straight chiropractic viewpoint from a few of my sources, I only used them to gain insight into the philosophy and principles in chiropractic from its inception. Also, getting to speak with Florida licensed chiropractors helped me connect with the history and ideologies on a personal level. Since I will be engaging with chiropractors, I will discuss my project with them in college. Also, once this short film has been graded, I will publicly post my video to YouTube on my personal account so that anyone interested can watch and comment. This will also allow people to discuss other aspects of my project that I neglected to touch on and mention ways I can improve my filmmaking and speaking skills. Also, when I graduate and move to chiropractic college, I will share my short film with other classmates to get them involved in the discussion. Our interactions will help both of us look at chiropractic in a transformative way. This research will also allow me to have a stronger passion for my work in the field and be able to explain to my patients what chiropractic is in a much clearer way. This way, the public will be able to understand what chiropractic truly is and how important it is to healthcare and their well-being.